Thanks for watching this video. My name is Dr. Alexander Anzarut, and I'm a plastic surgeon on Vancouver Island. And this video is entitled Everything You Wanted to Know About Neck Lift, Facelift, Neck Sculpting, and the Aging of the Lower Face and Neck. A little bit about me and my interest in neck surgery. I believe strongly that improving training and constantly learning provides better outcomes for my patients and makes my job more enjoyable. I completed medical school in Vancouver at UBC, plastic surgery residency at the University of Alberta, a master's degree there, a fellowship in burn care there. I completed a fellowship at the University of Pittsburgh as well as the University of Brussels, as well as a fellowship in Perth, Australia. I've done additional observerships and training around the world. Two of the biggest influences in my face and neck lift surgery include Brian Mendelsohn, who is an incredible anatomist in Melbourne, Australia, and Timothy Martin, who has really defined and explained the goals of clinical neck lift surgery for all of us. This talk is going to focus on aging of the neck and why changes of the jawline and neck are significant, what causes them, how they're treated, the side effects of treatment, the risks of treatment, the expected recovery, and some sample cases. Significance of the aging neck and jawline. Research studies have shown changes of the neck and jawline lead to the appearance of aging more than changes of the central face. These red lines show the area that I'm talking about. And you can see when we look at this picture of Queen Elizabeth as she's changed over time, the changes in the neck are very significant. As individuals, we may focus on the central face when we're looking in the mirror. However, looking at others, we tend to focus more on the jawline and the neck. And the circle here shows the area of the central face, and the red area shows the neck and jawline. Features of a youthful neck include a sharp angle between the chin and the neck, which we see on the left, a unified, well-defined jawline from chin to the corner of the jaw under the ear, which we see with the red line, which is lost in the older Queen Elizabeth. A smooth neck with no muscular bands and good quality skin. On the other hand, features of an old neck are reviewed here, and they include the angle between the chin and the neck changing from an acute angle in the young Queen Elizabeth to an oblique angle, as seen here. The jawline becomes indistinct, so much so that the neck and the cheek meld into one. The jawline and chin become more distinct and two separate structures, as seen here. Muscular bands begin to appear in the neck, and the skin quality worsens and wrinkles. The causes of the aging neck are shown here. The main factor is that the deep structures of the neck enlarge and drop downward. In the picture on the left, the deep structures are small and held up. With time, they enlarge and drop down, pushing the neck outward. The angle between the chin and neck changes from acute to oblique because of this. The distinct jawline is lost because of this. The cheek also drops down below the jawline with age, and this is what gives us a jowl. And it also leads to a distinction between the chin and the cheek. The anatomy of the platysma muscle will also change, and bands appear in the neck. Finally, sun damage leads to worsening skin quality and wrinkling and color changes of the skin. Treatment of the aging neck involves several maneuvers. The key is to improve the neck by treating the deep layer. The deep layer enlarges and drops with age. And this leads to loss of acute angle between the neck and the chin, and loss of a distinct jawline along the neck, between the neck and the cheek. Treatment involves reduction and removal of the deep fat, muscles, and glands that are causing this deformity. Unlike techniques that rely on lifting, sculpting the neck will result in a new shape, a more youthful shape that will hold its improvement over time. This is done through a small incision under the chin. This slide shows some of the deeper structures that have been removed from an aged neck, and they include the deep fat, a portion of the submandibular salivary gland, and a portion of the digastric muscle. Muscle bands form in the neck with age. These are from the platysma muscle. Treatment of these bands involves sculpting the platysma muscle so that the bands disappear and do not recur. The superficial layer of the neck includes the skin that we can see and the superficial fat just under this. Damage to the skin and this superficial fat leads to an aged appearance. Damage to the skin leads to wrinkles, excess skin, and color changes. Damage to the fat, this superficial fat, as opposed to the deep fat, leads to loss of the smooth contour in the neck and a skeletonized appearance. Treatment of the superficial layer involves redraping the skin and removal of excess skin. This is done with surgical resection or excision. The scar is hidden around the ear, and the length of the incision depends on the amount of skin that needs to be removed. Removing the superficial fat with liposuction, chemicals, cryotherapy, or energy treatment devices can lead to a skeletonized neck and increased loose skin. This should be avoided. Side effects of facelift, neck lift, and neck sculpting procedures are things that often do happen, and happen in many cases, if not all cases. This includes bruising and swelling, scars, numbness, pain, discomfort, sore throat, mouth opening difficulty, having to have a drainage tube, changes to motion around the mouth, dry eye, and stiffness, as well as woody feeling in the deep scar tissue of the neck. Most, if not all of these, are temporary. Bruising and swelling will happen to all patients to some degree. The maximum amount of bruising and swelling occurs after 4 days. Bruising is most significant around the eyes and the jowls. Bruising will last 1 to 3 weeks, and deep swelling along the jawline can be significant and can take 3 to 12 months to resolve completely. This diagram shows a patient with his drain in place and significant swelling, as well as hemonet sutures in the neck. This is the same patient at approximately 2 weeks with significant swelling around the jowls, jawline, and under eye area. This is the same patient after approximately 3 months' time. His swelling and bruising has almost completely resolved. There are ways to reduce swelling and bruising. The drains are very helpful for this. and the drain is left in place for 1 week to reduce the amount of fluid that collects, because this will lead to more swelling and longer recovery times. It is also important to avoid medications that cause bleeding for 3 weeks prior. All anti-inflammatories or pain medications other than Tylenol should be stopped. You should avoid foods that cause bleeding for 3 weeks prior. This includes garlic and ginger. You should avoid all vitamins, training supplements, herbal supplements, all for 3 weeks. And consider using Arnica montana before and after surgery. I have provided a link to all the medications and foods that may cause bleeding. My office will also provide a printout list of this. After any surgery, there will be incisions that lead to some scarring. There is an incision under the chin that's used to perform the deep work. And there is also an incision around the area of the ear that is used to remove the excess skin and treat the jowls. This shows the standard facelift incision around the ear and under the sideburn. For patients with lots of excess skin, the incision may extend along the hairline behind the ear and in front of the ear, as seen here. This shows a picture of the incision after it is healed in one of the patients who has been treated. The incision lies in front of the ear and then behind the tragus, and then goes in front of the ear again and then behind. After surgery, there will be an area of temporary numbness. This is shown here in yellow. Most sensation returns in the first 3 weeks. You may notice slight twinges as the sensation returns. Sensation to the earlobe takes the longest to recover. After surgery, there will be pain and discomfort, more discomfort than pain. Most patients have minimal pain and take Celebrex, which is an anti-inflammatory, and Tylenol 3 for pain control, and prednisone to reduce swelling. The discomfort is associated with having a sore throat secondary to the anesthetic tube, some trouble swallowing, stiffness in the jaw and neck, trouble with very wide mouth opening, a woody feeling in the neck, and discomfort from the drain. All of these things subside with time. The drainage tube stays in place for 1 week. Although the drain is uncomfortable, it is important. If fluid is not drained from the neck, it will increase bruising, swelling, and scar tissue in the neck. All of this will delay the healing process. I have a video to explain how the drain works and how you will be managing the drain after surgery. Patients will also have temporary changes to the motion around the mouth. This may last a few hours to a few weeks. After surgery, there is temporary asymmetry around the mouth, with some of the depressor muscles or muscles that lower the lip not working as well. The picture on the left shows the depressor muscle not working on the left side of the patient. He is trying to pull down his lip, and it is only coming down on the right side. The other photo shows the patient at rest or with a smile, where it is not noticeable. If for some reason this occurs, Dr. Anzarut will use Botox to create symmetry as the muscles recover their normal function. There will be deep scar tissue in the neck. The deep scar tissue leads to a feeling of stiffness and woody feelings in the neck. This can last from 3 to 12 months, and it is a normal part of the healing process. In the first 3 weeks, I recommend avoiding excess motion of the neck and avoiding massage in this area, as it can lead to significant complications. If you have concerns or an idea, please review it with Dr. Anzarut. Not all the information on Google or other plastic surgery sites is consistent or safe after this type of surgery. Patients will also have weakness of eye closure, and this may lead to the eye not completely closing at night while asleep. This can happen during the first few days to a week after surgery. To avoid any troubles with dry eye, one should place an ointment in the eye prior to going to sleep. This is an example of one of the gel ointments that can be used. The neck tightness and woody feeling in the neck area is caused by scar tissue. After the surgery, the neck will feel tight and stiff. During the early healing process, it is important that this scar tissue forms to allow for healing. Once the healing is complete, scar tissue will start to soften on its own. This patient is shown 4 days after surgery by Dr. Anzarut. The most common complication after neck or facelift surgery is bleeding. Collections of blood under the skin is also called a hematoma. Most of the time, this can be simply drained in the office. Rarely, it may require surgery with a general anesthetic, and very rarely, bleeding can require a blood transfusion or be life-threatening. To prevent bleeding, Dr. Anzarut takes the following steps. Identify medications, supplements, and food that increase bleeding, and you're instructed to stop these at least 3 weeks prior to surgery. High blood pressure is treated with medication as needed. Drains are placed, and quilting sutures are placed. The quilting sutures generally are removed after a few days. The drawing on the right side shows quilting sutures in the neck of a patient. The other complication that can occur after any surgery, including face and neck lift surgery, is blood clots. Blood clots can occur in the calf after a long period of immobility, such as surgery, and travel to the lungs, where they can be life-threatening. To prevent this complication, we use calf compressors, which massage the calves while you are asleep. We recommend you use non-prescription support stockings after surgery, and walk the distance of the bathroom and back every hour while awake after the surgery. Another complication that can occur is the collection of saliva from the area where the submandibular gland is trimmed. This is a rare complication, but when it does occur, it can be treated. It is generally treated with a medical patch that reduces salivary production, Botox injections, which reduce salivary production, and the placement of a drainage tube, which may stay anywhere from 5 days to 2 weeks. Skin loss or necrosis is also possible. It is possible that some of the skin changes to a scab, and there is a slight increased chance that you will develop a wider scar underneath this. To avoid this problem, avoid nicotine products, avoid using ointments on the incisions other than Vaseline, and clean the incision line daily with hydrogen peroxide spray multiple times. You may also shower immediately after the procedure to keep the area clean. This slide goes over what to expect. 3 weeks prior to your procedure, you should stop medications, supplements, and foods that increase bleeding. You should plan to arrive at the surgery center in the morning at approximately 7 o'clock, and you will be going home the same day. The night prior to the procedure, it is important to shower and avoid any makeups or creams on the face that morning. Bring loose-fitting clothing that is comfortable to get in and out of. You must have someone pick you up afterwards and have a responsible adult stay with you for 24 hours. If you're not from the Cowichan Valley and your procedure is being done on Vancouver Island, you must arrange to stay in the Cowichan Valley for at least one night. I will provide my cell phone number to you so that after the procedure you can contact me by phone or text at any time. On the first day after surgery, you will be swollen, bruised, you'll have a sore throat and feel uncomfortable. You should have minimal pain. I will see you at your hotel or in the office the next morning to review your surgery and your aftercare. 3 to 4 days after the surgery, the quilting sutures are removed and a compression tape is applied. 1 week after surgery, the drain is removed, the remaining sutures are also removed, and the compression tape is reapplied. 3 weeks after surgery, you will be presentable in public. Signs of surgery such as bruising and bleeding, as well as the incisions, will still be noticeable but can be hidden easily with clothing, a scarf, or makeup. 4 weeks after surgery, you can start to return to activities that slightly increase your heart rate. You will start gently increasing the amount of motion in your neck as well. 6 weeks after surgery, you can return to full activities, including sports, and you will start gentle neck massage and scar massage. If you wish to have your hair dyed or colored, you can at this point in time. At 3 months, you should be ready for photos and major events. The neck will still feel firm and woody, and by 12 months, you should be fully healed. This is a case of a 63-year-old woman who had a facelift with fat grafting and a brow lift. Her photos will be reviewed, both the preoperative photo, the photo immediately post-operatively, the photo at 1 year and 2 years after surgery. This shows the oblique view and how the neck sculpting procedure produces lasting changes in the jawline and neck. The top photo is before, the next is 1 week after. Along the bottom photos, we see 4 months after and 2 years afterwards. Her result has maintained its shape quite well. The results are long-lasting for the neck sculpting. These photos here on the top row show before and 1 week after, while the bottom row shows 4 months and 2 years afterwards. Neck lift surgery, neck sculpting surgery, and facelift surgery primarily enhance the side profile. This is the straight-on profile of the same patient. The top row again shows before and 1 week after, and the bottom row shows 4 months after and 2 years after. This is another case of a 75-year-old woman who had a facelift, neck lift, and fat grafting. These photos will be reviewed and include the preoperative photo, the photo immediately after surgery, 1 year after surgery, and approximately 2 years after surgery. Again, the neck lift will primarily improve the side view. This is the front view. And on the top row, we see before, 3 weeks after, 4 months after, and 2 years after. In this patient, even from the front, there is a significant improvement that is held over time. The main improvement is from the oblique or side views. The top row again shows the before, 3 weeks after, 4 months after, and 2 years after. This shows the side view in the same patient, and it shows that the neck sculpting changes the shape, and this lasts for a long time. There can be some recurrence of skin crepey changes, and these can be addressed fairly easily with a touch-up procedure. The top row shows before and 3 weeks after, and the bottom row shows 4 months after and 2 years after. Thank you for watching. Please like, share, and ask questions if you enjoyed this talk. Email or call the office for more information if you would like to know whether neck lifting surgery and neck sculpting surgery would be right for you. And stay tuned for further video presentations on facelifts, tear trough treatment, custom facial implants, and brow lifts.